What if the most dangerous time for your blood pressure wasn't during stress at work or late at night, but the moment you wake up? For millions of people, blood pressure spikes unusually high in the early morning. Doctors call this morning hypertension, and it's far more serious than many realize. Why? Because morning blood pressure surges are strongly linked to heart attacks, strokes, and sudden cardiac events. In fact, most cardiovascular emergencies happen in the morning hours when this hidden risk peaks. But not everyone experiences it. Some people's blood pressure rises normally, while others face dangerous spikes. Genetics, hormones, sleep quality, and lifestyle all play a role. In this video, we'll uncover why morning hypertension happens, who's most at risk, and what you can do to detect and manage it before it harms your health. What is morning hypertension? Morning hypertension refers to a condition where a person's blood pressure rises abnormally high in the early hours after waking. While it's natural for blood pressure to increase slightly in the morning as your body prepares for the day, in some people, this surge is much stronger than normal, and that's where the danger begins. Normal morning surge versus morning hypertension. Normal surge. After waking, your body releases hormones like cortisol and adrenaline, which help you feel alert. These hormones naturally raise blood pressure by about 10 to 15 millimeters of mercury. Morning hypertension. In some individuals, the spike is much greater, sometimes pushing systolic blood pressure above 135 to 140 millimeters of mercury or higher right after waking. This abnormal rise is what sets morning hypertension apart. Why doctors take it seriously? Morning hypertension isn't just a quirk of timing. Research shows that people with high morning blood pressure are more likely to suffer heart attacks, strokes, sudden cardiac death, damage to arteries and organs over time. Since most people measure their blood pressure during the day or at the doctor's office, these morning spikes often go undetected. That means someone might think their blood pressure is controlled, when in reality, they're facing hidden risks every single morning. Morning hypertension versus general hypertension. Regular hypertension means blood pressure is consistently high throughout the day. Morning hypertension can occur even in people whose blood pressure looks normal at other times. This is why it's sometimes called masked hypertension, because it hides unless you check at the right time. Morning hypertension is not just a normal part of waking up. It's a dangerous condition where blood pressure rises too much, too fast, putting added stress on the heart and blood vessels. Left unchecked, it can increase the risk of life-threatening events. Recognizing it is the first step toward preventing it. The body's natural blood pressure rhythm. To understand morning hypertension, we first need to look at how blood pressure normally behaves throughout the day. Blood pressure isn't a fixed number. It follows a natural rhythm, rising and falling in response to your body's internal clock, also known as the circadian rhythm. The daily cycle of blood pressure. Nighttime dip. During sleep, blood pressure naturally drops by about 10 to 20% compared to daytime levels. This dip allows the heart and blood vessels to rest and repair. Morning surge. Within the first 1 to 2 hours after waking, blood pressure rises as the body prepares for activity. Hormones like cortisol and adrenaline are released, making you alert and giving energy, but also raising blood pressure. Daytime peak. Blood pressure stays higher during the day, fluctuating with activity, meals, and stress. Evening decline. In healthy individuals, pressure begins to lower again before bedtime, preparing the body for another nighttime dip. This pattern is normal and essential for cardiovascular balance. When the rhythm goes wrong, problems arise when this natural cycle becomes disrupted. Non-dippers. Some people's blood pressure doesn't drop enough at night. This lack of rest increases strain on blood vessels. Extreme morning surge. For others, blood pressure spikes far more than normal after waking. This is the hallmark of morning hypertension. Both patterns are associated with a higher risk of heart attack, stroke, and organ damage. Why morning surges are risky? The morning hours, roughly 6 a.m. to noon, are already the most dangerous period for cardiovascular events. Studies show heart attacks and strokes are most common in the morning. Blood clots form more easily after waking due to changes in platelets. Arteries are stiffer in the morning, so sudden surges put extra strain on them. When you add morning hypertension into the mix, it becomes a perfect storm. Higher blood pressure, thicker blood, and less flexible arteries, all at the same time. Hormonal influence. Cortisol, known as the stress hormone, peaks in the morning, naturally raising blood pressure. Adrenaline also rises, preparing the body for activity. For most people, this increase is safe, but in those prone to hypertension, the hormone-driven surge becomes excessive. Blood pressure normally follows a healthy rhythm, dipping at night and rising gently in the morning. Morning hypertension happens when this rhythm goes too far, with blood pressure spiking to harmful levels just as the body is most vulnerable. Recognizing this abnormal pattern explains why so many heart-related emergencies occur shortly after waking. Why some people get morning hypertension. Not everyone experiences abnormal morning blood pressure spikes. For some, the morning surge stays within a healthy range, while for others it shoots up to dangerous levels. But why? The answer lies in a combination of genetics, hormones, lifestyle, and underlying medical conditions. 1. Genetic predisposition. Some people inherit a tendency towards stronger blood pressure surges. Variations in genes related to the renin-angiotensin system, which regulates blood pressure, can make morning spikes more likely. If hypertension runs in your family, you may be more prone to abnormal morning readings, even if your daytime blood pressure looks normal. 2. Sleep problems. Poor sleep is one of the biggest drivers of morning hypertension. Sleep apnea is a major culprit. In sleep apnea, breathing repeatedly stops and starts during sleep, dropping oxygen levels. Each episode triggers a surge in stress hormones, which raises blood pressure overnight and especially in the morning. Insomnia or restless sleep prevents the normal nighttime dip in blood pressure, so pressure stays high and spikes more sharply after waking. 3. Stress in the nervous system. Some people have an overactive sympathetic nervous system, the fight-or-flight system. When they wake up, stress hormones flood the body, leading to sharp spikes in blood pressure. Emotional stress, anxiety, or even rushing in the morning can exaggerate this effect. 4. Hormonal fluctuations. The natural rise of cortisol and adrenaline in the morning is stronger in some people. Conditions like Cushing's syndrome, excess cortisol, or thyroid problems can make this surge extreme. Women may notice changes around menopause, when protective estrogen declines, leading to higher morning blood pressure. 5. Lifestyle factors. Evening habits can heavily influence morning readings. High salt intake at night. Eating salty foods at dinner or before bed causes the body to retain fluid, raising pressure overnight. Alcohol consumption, drinking in the evening, can disrupt sleep and raise blood pressure the next morning. Late night stress or work, going to bed tense or over-caffeinated can prevent the normal nighttime dip. 6. Medication timings. Some blood pressure medicines taken in the morning wear off by the next day, leaving people unprotected during early hours. In these cases, adjusting the timing of medication, for example, taking certain drugs at night, can smooth out the morning surge. This approach is called chronotherapy and is an area of growing interest in hypertension care. 7. Underlying health conditions. Certain medical problems make morning hypertension more likely. Chronic kidney disease. Damaged kidneys can't regulate fluid balance properly, leading to overnight pressure buildup. Diabetes. Alters blood vessel flexibility and hormone responses, worsening morning surges. Obesity, often linked to sleep apnea, poor sleep quality, and hormonal imbalances, all drivers of morning hypertension. Why it's not the same for everyone. It's the interaction of these factors, genes, sleep, hormones, lifestyle, and medical conditions that explains why some people face dangerous morning spikes while others don't. For one person, it may be a salty dinner and poor sleep. For another, it may be family history and medication timing. Morning hypertension doesn't happen randomly. It's the result of multiple influences that make the normal morning rise in blood pressure go too far. By identifying the specific causes, whether sleep apnea, medication timing, or lifestyle, You can take targeted steps to control it and reduce the risks it brings. Morning hypertension and hidden risks. Morning hypertension isn't just a matter of numbers on a screen, it's a warning sign. While blood pressure fluctuates naturally throughout the day, an abnormally high morning surge has been linked to some of the most dangerous cardiovascular events. Let's explore the risks that make morning hypertension especially concerning. 1. Higher risk of heart attacks. Studies show that heart attacks are most common in the morning hours, between 6 a.m. and noon. Why? Because the morning surge in blood pressure increases demand on the heart at a time when arteries are stiffer and blood is thicker. If someone already has narrowed arteries due to plaque, this sudden rise in pressure can rupture a plaque and trigger a heart attack. People with morning hypertension are therefore at an especially high risk. 2. Increased stroke risk. Morning surges put extra strain on cerebral blood vessels. Research shows that people with morning hypertension are more likely to suffer ischemic strokes from clots and hemorrhagic strokes from ruptured vessels. The combination of higher blood pressure, increased clotting tendency, and vessel stiffness in the morning creates a perfect storm for stroke. 3. Sudden cardiac death. Morning hypertension has been associated with a higher risk of sudden cardiac death. The combination of high pressure, increased heart rate, and electrical instability in the heart during morning hours makes this a particularly vulnerable time. 4. Damage to arteries over time. It's not just about immediate events. Repeated daily surges in blood pressure cause micro tears in artery walls, leading to faster plaque buildup, arterial stiffness, making vessels less able to absorb pressure, left ventricular hypertrophy, thickening of the heart muscle, which raises the risk of heart failure. Over time, this hidden damage increases the risk of chronic heart disease, kidney damage, and cognitive decline. 5. Missed diagnosis. One of the biggest dangers of morning hypertension is that it often goes unnoticed. Many people only check their blood pressure at the doctor's office or during the day when levels appear normal. This leads to masked hypertension, where people believe they're safe but are actually at high risk every morning. Without early detection, treatment is delayed and the damage continues silently. 6. Why morning hypertension is a red flag. Doctors consider morning hypertension one of the most important signs of uncontrolled or high-risk hypertension. It often signals that current medications may not be working properly. Lifestyle factors like sleep and diet need urgent attention. The patient is at higher risk for cardiovascular emergencies. Morning hypertension isn't just a temporary spike, it's a red flag. It signals increased vulnerability to heart attacks, strokes, sudden death, and long-term artery damage. Because it often goes undetected, recognizing and addressing morning hypertension could be the difference between silent risk and life-saving prevention. Who is most at risk? Morning hypertension doesn't affect everyone equally. Certain groups are far more vulnerable to these abnormal morning spikes, and knowing who is at risk helps with early detection and prevention. 1. Older adults. As we age, our arteries naturally become stiffer and less able to expand when blood pressure rises. Older adults also experience weaker nighttime dips in blood pressure, making morning surges more pronounced. This combination explains why morning hypertension is especially common and dangerous in people over 60. 2. People with uncontrolled hypertension. If you already have high blood pressure that isn't well managed, you're more likely to experience abnormal morning spikes. In many cases, morning hypertension is a sign that your current treatment plan isn't working effectively, either due to lifestyle factors, medication timing, or inadequate dosing. 3. Patients with sleep disorders. Sleep apnea is one of the strongest risk factors for morning hypertension. Interrupted breathing raises blood pressure throughout the night, with sharp spikes after waking. Insomnia or poor sleep quality can also disrupt the normal nighttime dip in blood pressure, leaving levels higher in the morning. 4. People with chronic conditions. Several medical conditions raise the risk. Diabetes alters blood vessel flexibility and hormone responses. Kidney disease impairs fluid regulation, raising pressure overnight. Obesity increases likelihood of both sleep apnea and abnormal hormone regulation. 5. Shift workers and irregular sleepers. People who work night shifts or have irregular sleep patterns often disrupt their body's circadian rhythm. Without a stable internal clock, blood pressure patterns can become abnormal, leading to exaggerated morning surges, even if morning for them is in the afternoon. 6. People on certain medications. Those taking short-acting blood pressure medications may find that the drug's effect wears off by morning, leaving them unprotected during the most vulnerable hours. This is why doctors sometimes recommend adjusting medication timing to target morning surges. Morning hypertension is especially common in older adults. People with uncontrolled hypertension, sleep disorders, chronic conditions, shift workers, and those on short-acting medications. If you fall into one of these groups, it's crucial to monitor your blood pressure at home, especially within the first hour of waking. How to detect morning hypertension. Morning hypertension is often called a hidden condition because it can slip under the radar. A person might have normal readings during the day or at the doctor's office, but still face dangerous spikes in the morning. The key to uncovering it lies in timing, consistency, and the right tools. 1. Home blood pressure monitoring. The most effective way to detect morning hypertension is to use a validated home blood pressure monitor. Doctors recommend checking your blood pressure within 1 hour of waking, before eating breakfast, drinking coffee, or taking medication. Take at least 2 readings, 1 minute apart, and record the average. Repeating this process for several days in a row provides a clearer picture than a single measurement. 2. Ambulatory blood pressure monitoring, ABPM. ABPM is a device worn for 24 hours that measures blood pressure at regular intervals, even while you sleep. It shows the full pattern of your blood pressure, nighttime dips, morning surges, and daily fluctuations. Doctors often use ABPM to confirm a diagnosis of morning hypertension or masked hypertension, normal in clinic, high at home. 3. Keeping a blood pressure diary. Tracking your readings in a notebook or app helps spot trends. Include the time of measurement, whether it was before medication, and any relevant details, e.g., poor sleep, stress. Over time, this creates a clear record that helps both you and your doctor see if morning surges are consistent. 4. Signs that suggest morning hypertension. While many people feel no symptoms, some may notice morning headaches or dizziness, fatigue even after a full night's rest, palpitations or a racing heartbeat upon waking, blurred vision or swelling in the morning hours. If these symptoms line up with elevated readings, morning hypertension may be the culprit. 5. Importance of detecting early. Catching morning hypertension early can prevent long-term organ damage, reduce the risk of stroke and heart attack, allow your doctor to adjust medication timing or dosage for better control. The only way to truly uncover morning hypertension is through timely monitoring. Measuring within an hour of waking, using home devices or 24-hour monitoring, and keeping a diary ensures this hidden risk doesn't go unnoticed. What you catch in the morning could save you from life-threatening complications later. How to manage and prevent morning hypertension. The good news about morning hypertension is that, while it's serious, it's also manageable. Once identified, there are effective ways to control it through lifestyle changes, medical adjustments, and consistent monitoring. Let's explore the most important strategies. 1. Improve sleep quality. Since poor sleep and sleep apnea are major drivers of morning hypertension, get screened for sleep apnea if you snore loudly, gasp during sleep, or feel excessively tired during the day. Treatment, like CPAP therapy, can significantly reduce morning spikes. Practice good sleep hygiene, keep a consistent bedtime, avoid screens before bed, and create a dark, quiet sleep environment. Limit caffeine and alcohol in the evening, which can disrupt normal blood pressure rhythms. 2. Adjust medication timing, chronotherapy. Sometimes it's not what medication you take, but when you take it. Short-acting blood pressure medications may wear off overnight, leaving you unprotected in the morning. Doctors may recommend shifting certain medications to bedtime dosing to help control early morning spikes. Never change timing on your own. Always consult your doctor before adjusting your routine. 3. Dietary changes. Limit evening salt intake. Salty dinners or late-night snacks raise overnight fluid retention, worsening morning hypertension. Eat more potassium-rich foods, bananas, beans, leafy greens, to balance sodium and support healthier blood pressure. Avoid heavy alcohol use, particularly at night, as it disrupts sleep and raises morning blood pressure. 4. Manage stress. Stress hormones are highest in the morning, which can worsen surges. Simple morning routines like deep breathing, stretching, or meditation can help lower stress-driven spikes. Avoid rushing. Waking up with enough time reduces stress-induced surges. 5. Consistent exercise. Regular physical activity lowers overall blood pressure and makes morning spikes less severe. Morning exercise is safe for many, but those with uncontrolled hypertension should consult their doctor before intense workouts in the early hours. 6. Monitor at home. Consistent morning checks give you and your doctor a clearer picture of how well your management strategies are working. Tracking your readings helps determine whether changes in medication timing, diet, or lifestyle are effective. 7. When to seek medical help. You should consult your doctor if your morning systolic pressure is consistently above 135 to 140 millimeters of mercury. You experience morning headaches, chest pain, or dizziness. You already have diabetes, kidney disease, or previous heart issues, since morning hypertension greatly raises risks in these groups. Morning hypertension can't always be prevented, but it can be controlled. By improving sleep, adjusting medication timing, eating smarter, managing stress, exercising regularly, and monitoring daily, you can protect yourself from the hidden dangers of morning surges. With the right approach, morning hypertension doesn't have to control you. You can take control of it. Conclusion. Morning hypertension is more than just a morning spike. It's a silent risk factor that can lead to heart attacks, strokes, and long-term damage if ignored. Unlike regular hypertension, it often hides in plain sight, showing normal readings during the day while striking hardest when your body's most vulnerable, right after waking. The good news? It's not unstoppable. By monitoring your blood pressure within the first hour of waking, practicing healthy sleep habits, managing stress, and working with your doctor to adjust medication or lifestyle, you can keep morning hypertension under control. Simple changes like reducing salt at night, improving sleep, and checking your numbers consistently may protect you from life-threatening complications. So if you've never checked your blood pressure in the morning, consider starting tomorrow. That single step could uncover a hidden risk and give you the chance to act early. If this video gave you valuable insights, hit the like button. It really helps the channel grow. Don't forget to subscribe for more doctor-approved content on blood pressure and heart health. And if you know someone with hypertension or at risk, share this video. You could be helping them prevent a heart attack or stroke. Thank you for watching.